In this video, we will discuss the iliac veins, focusing on their anatomical course, relationships, and clinical significance. To do so, we will start by a brief introduction, followed by detailing the common iliac veins, the external iliac veins, and the internal iliac veins. We will explore some clinical applications, and finally a conclusion. The common iliac veins are 2 in number and are branches of the inferior vena cava. They arise from the union of the external iliac vein and the internal iliac vein, draining the pelvis and the lower limb. Let's start by detailing the common iliac veins. The common iliac veins originate from the union of the external iliac vein and the internal iliac vein at the level of the sacroiliac joint. They terminate by merging with each other on the right side of the L5 lumbar vertebra to form the inferior vena cava. The right iliac vein is located behind its corresponding artery. The artery becomes lateral to its termination. It lies posterior to the obturator nerve and receives the right ascending lumbar vein. However, the left iliac vein is located behind its corresponding artery, obliquely directed to the left and below the artery. It lies anteriorly to the sigmoid mesocolon and the superior mesenteric vessels, laterally to the gonadal vessels and the obturator nerve, and posteriorly the L5 vertebral body. Let's talk now about the external iliac veins. It is a continuation of the femoral vein below the inguinal ligament. It ends by joining the internal iliac vein to form the common iliac vein. The external iliac artery lies laterally to the origin of the external iliac vein. It then tends to become slightly superior towards its termination. In males, the vas deferens crosses the vein at its origin, and the medial and intermediate iliac nodes are located along its inferior and medial borders. The tributaries of the external iliac veins are the inferior epigastric veins and the deep circumflex iliac veins. Moving on to the internal iliac veins. The internal iliac vein is approximately 4 cm in length and 15 mm in diameter. It originates at the level of the sacroiliac joint. It then joins the external iliac vein to form the common iliac vein. It is anatomically related to. Posteriorly, each vein is in relation to the piriformis muscle and the sacroiliac joint. And anteriorly, the right vein is in relation to its homonymous artery, which separates it from the ureter, while the left vein is in relation to the ureter and laterally to its homonymous artery. The tributaries of the internal iliac veins are: the internal iliac vein drains the visceral plexuses with the middle rectal vein and the uterine vein, whilst the parietal branches drain the pelvic walls and perineum and include the superior and inferior gluteal veins, the lateral sacral vein, the obturator vein, and the internal pudendal veins. Let's explore now some clinical notes and applications. May-Thurner syndrome, MTS, also known as iliac vein compression syndrome, is a vascular condition in which the left common iliac vein is compressed by the overlying right common iliac artery against the lumbar spine. This compression can lead to reduced blood flow, causing a higher risk of deep vein thrombosis, DVT, in the left leg. Although it may be asymptomatic, patients can present with unilateral leg swelling, pain, a sensation of heaviness, and sometimes visible varicosities or skin changes. Diagnosis typically begins with Doppler ultrasound, but more detailed imaging such as CT or MR venography is often required. To conclude, the common iliac veins allow for the drainage of venous blood from the pelvis and the lower limb toward the inferior vena cava. Throughout their course, the iliac veins are in relation with various organs and vessels of the pelvis.